the psychomotor skill of manipulation. I think that's really the hallmark of what chiropractors do. The COVID outbreak has highlighted that there are elements in the profession who very easily can tend to move away from ethical practice.
Hello and welcome to our latest in our series of leaders interviews, and today I'm delighted to have Dr. Chris Yelverton on the line from Johannesburg, and he is the course leader at Johannesburg University, and it gives me great pleasure to introduce Dr. Chris Yelverton. Hi Chris.
Hi Matthew, thanks for the opportunity here. This is great.
So Chris, what do you think makes a good chiropractor?
So that's not really an easy question to answer, because I think there's multiple facets to what makes a good chiropractor. I think on the one hand, we obviously have to focus to some degree on the psychomotor skill of manipulation. I think that's really the hallmark of what chiropractors do, and why most people go to chiropractors is to get manipulated. So we can't forget that's a key component, and also to on a kind of second level to that in terms of skill, to be able to integrate multiple evidence-based modalities and interventions with manipulation to try and enhance the effect that we can get from the manipulation and the overall outcomes. I think from a personal level as well, I think what makes a good chiropractor is the ability to empathize with people and to understand the importance of the biopsychosocial aspects of musculoskeletal health and interventions that we use. I think also, so ethically, I think that's really important. I think as a credible healthcare profession, I think that ethics within the profession is really important, and the ability of practitioners or chiropractors to be able to integrate good ethical practice within their practices as well. I think that's overall what we need to try and focus on in any healthcare profession, but importantly for chiropractic as we move forward in chiropractic as a discipline.
And how do you think we're dealing with the ethical issues, both globally and in South Africa?
So I think in some levels, I think that we're doing really well. I think that in most countries where chiropractic is regulated formally, I think that issues of informed consent and ethical approaches or healthcare ethical approaches to patients are fairly well established and regulated really well. Organizations like the General Chiropractic Council and the Allied Health Professions Council and those sort of organizations, I think are really implementing and strictly controlling those. I think that there is always a risk in countries where it's not formally regulated, where there's a lot more leeway for practitioners. And I think that does lend itself to practitioners who might not be adhering that much to the ethical practice. I think that also the COVID outbreak has highlighted that there are elements in the profession who very easily can tend to move away from ethical practice. Advertising false claims about chiropractic and COVID is just a current example of I think what a lot of regulators have had to deal with in the profession. And I think that as I said, the places where it's regulated, I think that can be controlled and contained. But in areas where it's not formally regulated and there's no consequence, I think that those are the areas where the profession needs to try and step up and see whether we can help the profession to be regulated, so that can also be maintained in those countries.
Yeah. And so there's only 2 chiropractic courses in South Africa at the moment. In fact, I think there's only 2 courses in the whole of Africa at the moment. So what do you think the future holds for chiropractic in your region and globally?
So look, I think if we look at the profession in South Africa, there's about 860 chiropractors in the country. So the numbers are still really low. And if we look at in most countries, their ratio, if you were to work out a ratio of numbers of chiropractors per program, I think that 2 programs at the moment in South Africa is probably the capacity that we can deal with. having said that, there is demand though, because if we look at our program specifically, with our recurriculated program, where before we used to get around about 400 applications for 40 places that we have. The last 2 years we've had 1,000 applications for 40 places. So there's definitely demand for education in chiropractic in South Africa, which is a really good thing, and it obviously bodes well for the future of chiropractic, not just chiropractic education. From an African context, it's a little bit more difficult, because in other African countries, chiropractic is not regulated. So apart from Namibia, where it is regulated, but the resources to start chiropractic programs is not readily available, because their numbers are even smaller. In most African countries, you're probably looking at numbers less than 100. So it's really difficult to really progress. I think the chiropractic programs in South Africa are both strong programs. They both have been accredited with the ECCE for many years, and I think that we were fortunate that when they started within higher education institutions, and I think that really helped to make sure that we adhered to educational principles firstly, but also that we had the rigid structure and credibility that comes with working within a higher education institution. And I think that will also be the trick moving into Africa into the future, is that any courses that need to be established established within higher education, accredited higher education institutions, so that we know that whatever training is happening, it is controlled at a high level as well. I think the education in South Africa for an African context is also very good. There is a lot of focus on non-musculoskeletal diagnosis and referral, because we do see a lot of patients that are non-musculoskeletal, and as primary contact practitioners, we obviously need to be well versed in that, to be able to make sure that patients are referred correctly when we're seeing conditions that are presenting as musculoskeletal but aren't musculoskeletal necessarily.
Yeah, for sure. And what do you think the main strengths are of having a program within a university?
So I think on the one hand, I think that resources is a very big component, especially when you're looking at subjects like anatomy and physics and physiology in your kind of core basic sciences. To get really good facilities for that is extremely expensive, and with being able to share resources with the chemistry department and the physics department, and having a dedicated anatomy department and physiology department that services the whole faculty, it means that you have access to much more resources than you would if you were a standalone institution, but just purely from a cost perspective. The other aspect to that kind of basic sciences is that you can immediately have access to experts within the relevant fields. So, having physiologists lecture physiology is obviously ideal. Although the curriculum is guided towards chiropractic, it means that we still have physiologists lecturing physiology and anatomists lecturing anatomy. So from the one side, I think that's a really important aspect. The other aspect, I think, is also staff development and access to good staff. When it comes to things like quality assurance, or even educational expertise. Most lecturers in chiropractic are chiropractors. So, we don't have a 4-year qualification in education. And within big institutions, it means that there's a lot of resources that you can tap into in terms of facilitating quality assurance processes, facilitating educational expertise, courses that universities run to facilitate educational expertise within different fields. And that would be very difficult for small institutions or institutions that are not within a big organization or bigger organization to be able to have access to. I think on a third level, I think that there is a very strong level of credibility that comes from being within a formalized higher education institution, as opposed to a college or a smaller institution. It's not to say that the education may be less, and I'm not denigrating any of the programs that are not within universities, But I do think that with being within a university structure and getting a degree that's awarded from a university automatically puts you almost on par with other healthcare professions, which are trained within higher education institutions.
And you touched on it there, one of the key benefits, it seems to me, is training alongside other professionals. What's your experience of that?
So in our faculty, we're really lucky with the professions that we're with, because we have nursing, we've got optometry, we've got podiatry, we've got emergency medical care, we've got homeopathy, and now recently they've started Chinese medicine as well. So it means that, and biokinetics, which is a kind of a sport therapist, I think it would be the equivalent in other countries. I think it's quite a unique South African qualification, a biokineticist. And it means that because we've got clinics on the same site as our clinic, it means that we do actually have access to a good inter-referral system. Firstly, it obviously benefits the patient because they can come to us and we can get them really quickly to see a podiatrist if they have a foot problem that we think that they need to have addressed. We can refer them to the biokineticist for rehabilitation if we think that they need that. But also from a student level, the students are interacting with each other at that level. And I think that that's really key for the future of the professional interaction, because if your students have got friends in biokinetics, for argument's sake, it's not a different profession. It's just a friend of yours that does something else that can help their patients. And I think that having it within a faculty like that, where they have that interdisciplinary ability, is a really key point in terms of the future of the profession as well, in terms of multidisciplinary inter-referral and working together.
Yeah, and you mentioned it there, the university clinics system, and tell us a bit more about the chiropractic clinic at University of Johannesburg.
So the UJ clinic, before COVID, we were seeing around about 1,500, between 1,000 and 1,500 consultations a month. The senior students in their master's year are the students that work within that clinic environment. It's slightly different to what the students will experience in private practice, because it's in a relatively poor environment, and it means that we're seeing patients that are trying to get into the public system, and the public system, certainly in South Africa, doesn't really respond well to musculoskeletal conditions. So on the one hand, we're seeing patients that are more severe potentially because they haven't had adequate treatment during the process. So by the time they come and see us, the process of the disease is a little bit further. But the other aspect is that we are seeing a lot more patients who are potentially misdiagnosed or have not been correctly diagnosed through the public system, that we're actually seeing, which you're not really going to see in private practice, because generally there people are coming to chiropractors because they know what a chiropractor is and what they have. So I think it's a really good experience for the students. I think the case mix that we have means that they see a large variety of different types of patients that are presenting there. We run it deliberately as a community-based clinic, where the fees are very low compared to what they would pay in private practice, so that we can really attract as many of the patients in the area as possible. Just having said that, though, when we've done our statistics, there's patients that live 50, 60, sometimes 100 kilometers away that are coming to our clinic, because it's just from a financial perspective, it's much more cost effective for them to come through. And especially, if patients have got multiple areas, for example, whether they've got arthritis in the hip and the knee and shoulders, our students have the time to spend to really work well on all of those areas. Whereas in practice, it's a lot more difficult for practitioners to address multiple joint areas like that within the timeframes of running their practices.
So, on the issue of diversity and attracting a diverse range of students into the profession, how do you feel we do as a profession and at your university?
So, in South Africa, obviously the diversity, as you said, is a little bit different. We've been trying to address diversity within the program for many years. And in chiropractic, it's actually quite difficult, because when we're trying to attract students, the majority of chiropractors in South Africa certainly, and I think that it is almost a problem around the world, is that they predominantly in the middle and upper class areas. So it means that you attracting a very specific niche area of the population which are applying for chiropractic, and obviously it's because that's the group of population that is getting exposure to chiropractic, and that's really the key, is trying to get the exposure more widespread, specifically targeting the areas where previously there was no chiropractic. And that's really difficult. It sounds really easy, but I think it's realistically, it's actually really difficult to be able to attract people and get them to understand what chiropractic is when there is no exposure in those areas. So certainly in our program, we, from a gender perspective, and in South Africa as well, from a gender perspective, in South Africa, we probably around about 55% female, which is a really good statistic internationally, I think. And in our programs, we generally sitting at around about 70% female in our programs. So from a gender perspective, I think that we do have a good balance in terms of what we're doing. I think that that's probably changing in a lot of institutions. I think if we look at most universities, there's a higher percentage of female students in most universities now. But obviously the other aspect of trying to enhance diversity is also looking at what the race categories are of the members of the profession. And even in South Africa, where our predominant race is obviously not white, the chiropractic profession is predominantly white. So it's a very difficult process and slow process, unfortunately, because if we're fixing it per year, it's each cohort that makes a difference, and it means that there's no quick fix. And I think that that's what we also need to be cognizant of in the profession as a whole, is that we don't rush into trying to create equity, where we need to understand that it's a process, and it's a mentorship process as well. Identifying people that need to be mentored, that will help with including the diversity, and really helping them to get the opportunities that are available to them, because it's not just going to happen by itself. It needs to be something that's actively pursued.
Yes, very true, very true. And finally, where do you think the profession will be in 10 or 20 years' time?
So we'll go with what I hope is where the profession will be in 10 to 20 years' time. I think I've been in practice now for 20 years, and if I look at where we were in South Africa 20 years ago, when I told people that I was studying chiropractic and I was a chiropractor, most of them didn't know what it was, and some of them, there's a colloquial term for it, and as soon as I used that, then they understood what it was. But it's not derogatory, but it doesn't really show what chiropractors do. So if I see how we've changed in the last 20 years, and through the works of organizations like the World Federation of Chiropractic, and big organizations that are really pushing chiropractic in the direction that it needs to go, I would hope that within 10 to 20 years, the profession really is equal to all the healthcare professions in the country, and that we're recognized for our ability to approach musculoskeletal health in a very unique way, where we haven't ended up losing our identity as chiropractors, but that we hang on to it, but we keep our uniqueness in terms of our approach. So integrating all of the other modalities that are available, but moving it forward. And again, we've said it before, but the evidence-based approach is really where it needs to be, because that, to me, is where the future of the profession has to go. If we don't adhere to the evidence-based principles and move forward in a strong biopsychosocial approach with the evidence-based approach, I think that that's really the key for the future of the profession, because then we can stand shoulder to shoulder with all the other musculoskeletal professions that historically have been accepted. And ideally, we should all be integrated into public health systems where we can show our value in terms of cost effectiveness and as an alternative that can be utilized effectively.
Yeah, Excellent. And as we draw to a close, is there anything else you want to talk about that I haven't asked you about?
The one thing that we didn't really touch on, and it's something that a lot of I could have probably brought it up in the previous discussion regarding being in a bigger institution, but I also think that the being in a bigger institution also potentially allows you to be more involved with research and to contribute to the idea of evidence-based practice, because evidence-based practice has got to be based potentially on, to some degree at least, on research. And I think really that's where educational institutions also need to look at how they handle that role. Again, historically, the organizations that were predominantly chiropractic might not have had access to the same resources, because research can be expensive, but also the expertise, where you can tap into expertise of people who have a vast amount of research experience to help and facilitate the development of research projects and research agendas within institutions, because I really think that needs to be where all chiropractic programs should be at some level, be contributing to formalized research, and not just to presenting it, but to having it published in recognized journals that add value. Because I think that we're doing a lot of good things in chiropractic, specifically also in chiropractic education, and some of the things that we're doing in chiropractic education could have an impact on all health professionals' education, but we're hanging on to it, and it's staying within our ranks almost, and we need to start leveraging that within publications, educational publications even, to show that we are able to contribute not just to chiropractic, but also to education in most healthcare disciplines. Because at the moment we kind of adopting a lot of the approaches that have been published by other healthcare professions, and I think we need to show what we're doing, because there's a lot of work that we're doing because of how we've started chiropractic education. I think that we're in a unique position where we actually have unique skill sets that I think we need to get out there a little bit more.
Yes, that's very true. And you'd like to tell us a bit about the journal that you've got in South Africa? That's an interesting project.
That's my little my baby almost. So that's the journal of the chiropractic clinician, and it's a South African journal that we put together. We had hoped that there would be enough impetus within the country to really start having the journal published every year, but unfortunately it's really difficult because we're competing against the recognized journals when we're approaching people to write up articles. So we've had 2 publications. They are available on the UJ website under the chiropractic department. And we've had some good contributions. The last publication that we had was last year in September. And we had 2 publications from overseas institutions, from ECCE and McTimoney. And the plan is that every 2 years we'll be releasing a publication of it, because I think that's a reasonable amount of time for us to collate the information, and it is peer reviewed, so it does go through the normal process of journal development and article development. And if you're interested, go to our website, www.uj.ac.za. Just go to our department and then go to the chiropractic clinician. Both the journals, the editions are available for free, and you're more than welcome to just go and have a look at them. And if you want to give me comments or feedback, just pop me an email. The email address is in there, so just pop me an email, and I'm more than willing to discuss or open to any kind of input that you have.
Great. Well, thanks, Chris. And having looked at the journal myself, there are some great articles in there, some great research going on in your neck of the woods. So, Chris Yelverton, thank you very much indeed for joining us. It's been an absolute pleasure to talk to you, and I wish you well in future developments at the University of Johannesburg.
Thanks very much, mate.